gonna talk to you about GBS, Guillian-Barré Syndrome, present by a first-year neurology resident. It's an acute, immune-mediated, symmetrical, paralyzing condition and is a heterogeneous condition with several variant forms. Most often is characterized by an antecedent event, some like infections, trauma, surgery, bone marrow biopsy, and vaccination. But I would like to remind you that getting a vaccination is better than actually getting the disease. So your chance of getting GBS is lower with vaccination. And for infections, I would like to specifically mark gastrointestinal infections and respiratory system infections. And the molecular basis of GBS is molecular mimicry, cross reactions. And in this hypothesis, when a pathogen comes to your body, it produces a similar structures to your own body parts. So your body immune cells are confused of which is from you and which is from the pathogen. So they attack both of them in the one time. And here the term monophasic comes to the place. It means it is once a time event. It doesn't mean that it can only be a one time in your lifespan, but it means it arises in a one time event. And the pathogenicity of it, I think, if I am not wrong. And in our case, GBS, uh, it is attacked peripheral nerve, specifically myelin or axon. Here I would like to show you a typical structure of a neuron. This axon part, it is the long conducting part of a neuron, and here the myelin sheath, it makes the isolation, so the conduction becomes faster and safer from the external stimulants. And most common precipitant factors, and specifically most common of it, Campylobacter jejuni infections, and others cytomegalovirus, Epstein-Barr virus, HIV, some hepatitis, and Zika newly, and recently COVID-19 cases. Its incidence is 1 to 2 per 100,000 per year. But in my own clinic, I see more cases of GPS, I think, rather than this ratio, and it increases with age after the second decade of life. Usually, a case of GBS uh, is characterized by a symmetric ascending from the distals of legs to upwards muscle weakness with absent or decreased DTRs. It developed in 1 to 4 weeks after the triggering event, and usually it develops in 2 weeks. And recently I read about a, a review related about COVID-19 associated GBS cases, and in there it can start from the third day on. The classification. I would like to talk to you about the classification shortly. And first one is AIDP, acute inflammatory demyelinating polyradiculopathy. It means the breaking down of myelin sheath, which isolate our nerve axons. And this one is the most common in USA and Europe, nearly 90%, if I am not wrong. And the second one is AMAN. This one is motor and axonal neuropathy, and it's usually seen 5 to 10% in USA or Europe, but in China, kind of Eastern countries, it's seen in more frequently, like 20%, and it can make epidemics of GPS in the summertime, related to Campylobacter jejuni, if I am not wrong. And here it's AMSAN, is acute motor and sensory axon neuropathy. We have an extra sensory thing here. And this was is like a more severe form of MN. Here we have Miller-Fisher syndrome and other regional variants. MFS is characterized by ataxia, loss of full control of bodily movements, and reflexia, loss of absence of reflexes, and ophthalmoparesis, which is a palsy of your eye muscles which limits their movements. Oh, sorry. And here, pharyngocervical weakness, which is characterized by a weakness in throat, neck, and shoulder, and it might contain also this difficulty of swallowing. And here, paraparesis form. This one is more specifically limited to lower extremities. So, and face paralysis form, poor oculomotor form, if, as you can understand from the name, is only oculomotor symptoms. And here some functional variants of GBS. Acute pandysautonomy. This one is characterized by of autonomic symptoms like diarrhea, dizziness, and stomach pain, urinary retention, and ileus, decrease in lacrimation, sweating, and invariant heart rate kind of. And here poor sensory GBS and ataxic GBS. For the diagnosis of GBS, the required features are a progressive weakness from minimal to your lower legs just make a bit of a difficulty walking to the maximal degree of mm, limiting your breathing movements, so you need a mechanical ventilation and a hypo reflexia. These two slides are from up to date, and I would like to uh, share with you some clues which makes GBS diagnosis more powerful, stronger. A progression of symptoms over days to 4 weeks. 80% reach in 2 weeks. Relative symmetry, mild sensory symptoms or signs, cranial nerve involvement, especially bilateral, meaning two sides in both in the meantime, in the same time, I think. And recovery starting 2 to 4 weeks after the progression has, and some autonomic dysfunction. This one is more common, I think, and some pain and no fever, because if there is a fever it might be some kind of direct infectional thing, and elevated protein in GSF without a cell count, with a cell count less than 50 millimeter cubes. GSF is, cerebrospinal fluid, and this has a specific name called albuminostologic dissociation. And some electromyography abnormalities consistent with GBS. As you remember, it has two forms like demyelinating and axonal. In demyelinating form is characterized by a decrease in the velocity of nerve conductions, and in axonal form is characterized by a decrease in the amplitudes of the conductions. And these following features make the diagnosis of GBS less strong. A sensory level, a marked asymmetry, and bowel and bladder dysfunction, and becoming it more severe and severe, and severe pulmonary dysfunction, severe sensory signs, fever, and GCF pilostasis. with a white cell count more than 50. GBS is an important disease because 10 to 30% of patients need mechanical ventilation. It means they need another machine to let themselves breathing, and 7.5% of all affected patients might die. And the treatment for GBS is IVIG, usually 2 grams for each kilogram in 5 days, and plasma exchange therapy is for 5 days, I think, also. And some kind of MFS variants you can actually maintain with symptomatic acetaminophen treatment. And thanks for your time. Sorry for my broke English. By the way, I would like to share with you that GBS is a very important disease because it has a treatment. And when I remember seeing my patients coming to my hospital without even uh, getting out of their bed, and after the treatment, they uh, slowly regain the control of their muscles, and just seeing them from turning in one side to another side is a very great moment for both of them, for them, and both of us, for us, is a very important thing and is very meaningful. Thank you very much. When I preparing this slide, I used up to date special things from me to the whole team, and some ratio for Wikipedia and some images, and the everyday knowledge I get. Thank you very much again and again.